this is the chapter Nursing Fundamental Lab Values or Laboratory References, I said here. So the first one, we are going to talk about the complete blood count. Complete blood count, or shortly called CBC. C stands for complete, B stands for blood, and C stands for count, complete blood count. So when the healthcare provider told you for the patient write down the CBC, you have to understand CBC stands for complete blood count. And CBC included the count the red blood cell, count the white blood cell, count the hematocrit, and also the platelet or platelet, right? All of them. So just go one by one. So the red blood cell here, red blood cell means shortly called RBC. RBC or red blood cell. So the normal red blood cell look like this. They are ovoid shape. They are very flexible, right? And they travel in your body through the blood. So blood contained the red blood cell. So basically the blood has a two portion. One part of called plasma and another part is called the corpuscle. So plasma is a liquid portion in the blood, and corpuscle basically contain red blood cell, white blood cell, and platelet. So plasma, red blood cell, platelet, and red blood cell, all together we say the blood. So if you divided the blood contains the liquid portion, what is called plasma, and blood contain the corpuscle or solid portion. The solid portion contain white blood cell, platelet, and red blood cell, right? Easy where we are going to. And we are going to focus in red blood cell here. So the normal red blood cell look like this, as I told, ovoid shape. And they transmit the oxygen, they transmit carbon dioxide, and they transmit the nutrient to the cell, right? So what are the function of the red blood cell? Don't say carry the oxygen. They also carry out the carbon dioxide. They also carry the micronutrient for cellular metabolism. Means they provide the nutrition to the cell, right? So basically the red blood cell, the total amount or number of the body, it is 4.5 to 5 million. But if you categorize man and female, in case of man, it is 4.7 to 6.6. In case of female, it is 4.2 to 5.4 million. So the number of red blood cell in case of man, it is little bit bigger than the female, because female blood loss is more than the man, like a menstruation every month and blood loss, right? So I told you for NCLEX board, we have to know what are the normal range of red blood cell. As I told, it is 4.5 to 5 million, or categorized 4.7 to 6.6 million in case of men, and 4.2 to 5.4 in case of female. So here, and now there are a little bit more talk about the red blood cell here. I said I just want to make sure we are not missing, and we should try to cover it in the classroom, so then you can save your little bit time here. So now here also the second here the picture what I said in here. So this is a red blood cell, and another cell is called eosinophil or neutrophil. They are white blood cell. So red blood cell contain the hemoglobin. Red blood cell contain the hemoglobin. Okay, and hemoglobin is basically carry out the oxygen. If the hemoglobin level is less than normal, patient has a developed anemia. So red blood cell basically contained iron and hemoglobin. Hemoglobin basically protein molecules, right? So hemoglobin, so when red blood cell is less than normal, or red blood cell easily broken down, that times hemoglobin concentration also go down, and patient develop the anemia. So hemoglobin normal range also we have to know. In case of man, hemoglobin is 14 to 18 gram per dl. In case of female, it is 12 to 16 gram per dl. So another question sometime NCLEX board asks, in case of female pregnant mother, what should be the target hemoglobin level? The target hemoglobin level in case of pregnant mother more than 11 gram per dl, more than 11 gram per dl. So hemoglobin, some books said the hemoglobin in case of men is little bit different. So don't be upset if you get like 14.5 to 18.5. So what is very close, what you know the normal range, you have to choose from the exam. And here I said anemia develops. So if the red blood cell go down, hemoglobin go down, and patient develop the anemia, right? So anemia, here is one picture showing the sign and symptoms of anemia, especially iron deficiency. The tongue is not coated, and the pale, if you see here, it should look like the pale, right? Because of deficiency of hemoglobin. So this is a normal range. We have to know about this. And now we are going white blood cell, another very important component in the body, right? So if your patient less RBC, less hemoglobin, patient develop anemia, but patient when come to you, they will not say, I have a anemia, please give me some treatment. Usually they do not say. They said, I feel tired. When I do something, then I get exhausted, tired, right? Because the tissue do not get enough oxygen to meet the demand. right? And they easily get tired. So basically, if anybody has an anemia for a long time, the chance of develop heart failure. For NCLEX board, you must know what are the signs and symptoms of anemia, the frequently asking question, right? Another cell in the in the blood is called white blood cell, WBC. Another name of white blood cell is called leukemia. Leukocyte. So leukocyte means white. Leuko means white cell. So red blood cell again categorized. There are several types of red blood cell like neutrophil, lymphocyte, monocyte, eosinophil, and basophil. They are type of white blood cell. So before to go the next, here I want to tell you the white blood cell, what are the expected range of white blood cell, okay? And we have to know what is leukopenia, what is leukocytosis, and also we have to know what is neutropenia, is very common, right? So basically, the expected range of white blood cell is 5,000 to 10,000 cell per cubic millimeter. Okay, so if the cell WBC is less than 5,000 or less than 4,000, we called leukopenia. So leukopenia can indicate the presence of autoimmune disease, bone marrow suppression, or drug toxicity. So if the WBC is more than 10,000, we told leukocytosis. So leukocytosis can indicate the presence of infection or inflammation. I want to recap it, my friend. I said that WBC, other name is called white blood cell. WBC, the normal range is 5 to 10,000. So if the WBC more than 10,000 indicate you have an infection in the body. And definitely if patient has an infection, they come to you with a fever or associated sign and symptom. So when the WBC is more than 10,000, I said it's called leukocytosis. When it's less than 5,000, it's called leukopenia. So leukocytosis indicate the infection or inflammation, but leukopenia less than 5,000 or 4,000 indicate patient has a autoimmune disease or bone marrow suppression or toxicity. So here a picture you can see. This is the long bones and this is called bone marrow. Bone marrow can produce red blood cell, they can produce white blood cell, they can produce platelet. So when red blood cell is less than normal, patient develop anemia. When the white blood cell, there are some subtypes of white blood cell, but before to go there, before to go next steps, I want to say white blood cell when less than normal indicate the bone marrow suppression or drug toxicity, or patient has a autoimmune disease. So bone white blood cell protect your body from infection, right? Infection. So this is the type of white blood cell. One is called lymphocyte, monocyte, eosinophil, basophil, and neutrophil. So the total percentage of neutrophil is bigger than anyone, in more number of the neutrophil. So when bacteria attack your body, neutrophil come first to fight. Why? Because neutrophil number is important. Because neutrophil can motile, right? Neutrophil, I said. So total number of the neutrophil in the body, 55 to 75%. So neutrophil increased during the acute bacterial infection. Another cell is here is called lymphocyte. The total number of the lymphocyte 20 to 40% in relation to other cell, white blood cell. Lymphocyte basically produce the immunoglobulin, T cell, B cell, immune cell. So lymphocyte increase during the chronic bacterial or chronic viral infection. Another cell is called monocyte. You see the kidney-shaped nucleus, but neutrophil 3 lobes nucleus. So when you can see them under the microscope, you can differentiate each other to see their shape of the nucleus. Monocyte, kidney-shaped nucleus. So usually the number of monocyte 2 to 4%, 2 to 8%, or indicate monocyte during the protozoal or viral infection. So if a patient comes to you with tuberculosis or TB, the monocyte go up. If patient has a chronic inflammation, monocyte go up. Another cell is called eosinophil. Eosinophil is 1 to 4% increase during the allergic reaction or parasite infection. Eosinophil, parasite infection, I said. And basophil, here, very less number of cell, like 1%. Basophil. So basophil is increased during the allergic reaction, right? So here showing white blood cell, neutrophil, multilobulated nucleus, eosinophil, 2 lobes in the nucleus, basophil, special dot, and also monocyte, kidney-shaped nucleus, lymphocyte. The nucleus is almost close, same size to the cell. So neutrophil total number is more. It is 55 to 75%. And when they increase the neutrophil, it indicate acute bacterial infection. Then I said lymphocyte, 20 to 40%. When increase the lymphocyte indicate chronic bacterial or viral infection. Then monocyte, it is 2 to 8%. Increase during the protozoal or viral infection like tuberculosis or chronic infection increase. Then eosinophil, it is 1 to 4% increase during the allergic reaction. So NCLEX board if asked, because of allergic reaction, which cell go up? Eosinophil. So another cell called basophil, it is 1 to 1% in relation to other white blood cell, increase due to the leukemia. What is leukemia? Is the cancer of white blood cell, right? So total number of cell is increased in case of leukemia. So this is very basic talk about the white blood cell, and the percentage is there. When you study yourself, you can find it out from here. So another important information we have to know about the white blood cell, especially the neutrophil. When the neutrophil cell is increased in, when the neutrophil is go down in the body, it's called neutropenia. It's called the neutropenia. So neutropenia, basically, neutrophil count less than 2000 per cubic millimeter of blood. Neutrophil is reduced or indicate, when neutrophil number is reduced, indicate compromised immunity. It indicates patient immunity is not stronger, weak immunities, right? So now we're going to talk about the hematocrit. Hematocrit, another measured cell, hematocrit, and finally we should talk about the platelet, right? I want to share one more things, like if NCLEX board asks a question, in case of urinary tract infection or UTI, which cell is going to up UTI, urinary tract infection, right? What cell? WBC going to up urinary in case of urinary infection. Yeah. So go hematocrit. What is hematocrit? We are going to talk about here, right? So as I told you, hematocrit is little bit related to the concentration of the white blood cell, also red blood cell. So like here, hematocrit here. So this is here. Suppose you collect the blood from the patient, and this is the test tube contain the blood, right? And when you collect the blood, and the blood you has to put in the centrifugation machine. You has to put inside the machine, and this machine is rotate, very highly speed. This machine rotate. When they rotate, after a few minutes, we can get separation of plasma and white blood cell, red blood cell. So plasma go the top, it is thinner liquid portion, and thick portion red blood cell go down. In between plasma and red blood cell, segregation of white blood cell and platelet, right? So this is the procedure we should to follow in the laboratory. So hematocrit, what it is, when you segregate it or centrifuged, we can get plasma on the top, on the down, hematocrit. So what is hematocrit? Hematocrit is the percentage of the pegged red blood cell in a centrifuged sample blood. So it is the percentage of the pegged red blood cell, right? So a centrifuge used to analyze the relative amount of red blood cell in relation to the plasma. So if the patient, as an example, if patient blood loss like a trauma or GI bleeding or like excessive menstruation is called menorrhagia. So in case of blood loss or sickle cell anemia, where the red blood cell is easily break down or broken down, sickle cell anemia. So this is the red blood cell easily break down and hemoglobin go down. That times RBC go down, hemoglobin go down, hematocrit go down. So in case of blood loss, sickle cell anemia, iron deficiency anemia, pernicious anemia, folic acid deficiency anemia, all of the cases, red blood cell go down, hemoglobin down, and hematocrit going down as well. So what is the normal range of hematocrit in case of men? 42 to 52%. In case of female, it is 37 to 47%. What is the target range of hematocrit in case of female? It is more than 33%, right? So I want to recap it. Red blood cell, hemoglobin, and hematocrit actually interlink each other. So if patient blood loss, RBC go down, hemoglobin go down, hematocrit go down. Blood loss. If patient has a sickle cell anemia, iron deficiency anemia, pernicious anemia, folic acid anemia, red blood cell go down, then hemoglobin go down, hematocrit go down as well, right? So here, let me show you. When you go in this PowerPoint, you can get same type of information about here. So now we are going to talk about the platelet, but here something I left, you can see hemoglobin and hematocrit. Hemoglobin is the main component of erythrocyte and serve as a vehicle for transport oxygen and carbon dioxide. Hematocrit is represent red blood cell mass and is an important measurement of the presence of anemia or polycythemia. So if the red blood cells go down, hemoglobin go down, we said anemia. If the red blood cell is more than normal, we call polycythemia. And now go the platelet. So platelet or platelet, here platelet is normal count is 150 150,000 to 4,000, 400,000. So all lakhs. So what I'm saying, the platelet indicate they are important to clot formation in the blood. So if suddenly you injured or cutting the blood will be lost. So platelet can come in the situation and they clot your blood and bleeding will be stopped, right? So as I told you, red blood cell when go down, anemia. White blood cell when go up, they have infection, right? Or when white blood cell is less in the body, infection easily catch up. And when hemoglobin go down, anemia. So platelet when less than normal, right? It is bleeding tendency is more common and causes the bleeding disorder. So platelet function in the hemostatic plaque formation. So when bleeding occur, they come clot formation and stop the bleeding. And this is called hemostasis. Platelet are produced by the bone marrow. As I told, bone marrow can produce red blood cell, bone marrow can produce white blood cell, bone marrow can produce platelet. So if patient has a bone marrow disease, all of the cell is go down, and this is called pancytopenia. Pan means all cell. So platelet are produced by the bone marrow, one, and the normal range. This is the normal range of platelets or platelet. So monitor for the venipuncture side of for the bleeding. Another question, when we go to collect the blood for complete blood count, we use the arterial blood or venous blood. We took the venous blood and it's called venipuncture. So high altitude or chronic cold weather or exercise increase the platelet count, and bleeding precursors should be instituted in the client with a low platelet counts. Specify values for implementing bleeding precursor, usually determined by agency policy. So here we said we have to monitor the platelet count very closely in case of the client who are taking the chemotherapies, means cancer medication. If any patient has a diagnosed by the cancer and you give them the chemotherapy, they have a chance of develop bone marrow suppression. If bone marrow suppression, it leads to all cell go down, pancytopenia. And one of the cell is called platelet. Platelet also go down, and this is called thrombocytopenia. So what is thrombocytopenia? Thrombocytopenia means the total number of platelet is go down, thrombocytopenia. In addition, in the client who will having an invasive procedure like thoracentesis should have coagulation study and platelet count done before the procedure. So here they said if patient has to go any kind of procedure like thoracentesis or any kind of major surgical procedure, we have to check the blood panel. We have to check the platelet count because of bleeding disorder. If patient has a bleeding disorder, definitely we have to prepare before to go for surgical, any kind of surgery. So now we are going to talk about the metabolic panel. Metabolic panel, we said. So this one are the important electrolyte in the body. Electrolyte. So sodium, potassium, calcium, magnesium, and phosphorus. We have to know what are the normal range of them, normal range. Secondly, we have to know when it is more than normal, when it is less than normal, what called, what are the sign and symptom. called. So here, as example, the sodium, they are electrolyte, my friend. So electrolyte imbalances occur if patient has a fluid volume deficit. Fluid volume deficit means like a patient has a vomiting or diarrhea. So vomiting or diarrhea means, vomiting means fluid loss through your mouth is called upper GIT. Diarrhea means fluid loss through the lower GIT. But both case fluid loss. When fluid loss, the electrolyte will be imbalanced. And one electrolyte imbalance can lead to other electrolyte imbalance. And finally, when potassium imbalance occurs, patient develop arrhythmia and patient is die because of dysarrhythmia. So potassium, sodium, calcium, every electrolyte is super important for our body. Like sodium and potassium, important component to maintain intracellular and extracellular balance. They're important for your heart, right? They're like calcium, magnesium is super important for your bones. It is minerals, maintains a normal mineralization, right? But keep in mind, when fluid volume deficit occur or when fluid volume excess occur, the electrolyte become imbalance. I said fluid volume deficit means if patient has a fluid loss because of vomiting, because of diarrhea, because of diuretics, because of hemorrhage or diaphoresis, like patient has a kidney problem or patient has a hyperventilation, the chance of fluid volume deficit. So definitely if patient has a chance of fluid loss or fluid volume deficit, we have to check the laboratory values of electrolyte, because patient has a chance of develop increase the hematocrit, increase the serum osmolarities, urine specific gravity will be changed, and definitely as a RN, we have some responsibilities. We have to take care of the patient, like fluid replacement, monitor patient body weight, and also notify healthcare provider if any abnormalities occur. Because if the fluid volume deficit or electrolyte imbalance, it leads to other complication, right? Same as I told you, if patient has a fluid volume excess is occur, fluid volume excess, like patient heart fail, or patient use too much steroid, or if the kidney dysfunction or liver does not work because of cirrhosis, or patient undergo to the burn or excess sodium intake, that times also electrolyte imbalance occur and healthcare provider tell to go for laboratory values. So again, I said if patient has a fluid volume excess occur, we place the patient, we as a RN, we have some responsibilities. What we have to do, we have to tell the patient and place the patient in a semi-polar or high polar position. We have to monitor the patient daily body weight. We have to monitor input output chart, and also we have to limit the fluid and sodium intake. right? Otherwise, it also develop the complication. In case of fluid volume excess, complication may be developed pulmonary edema. If fluid volume deficit, complication develop like hypovolemic shock or admin oxygen administer oxygen colloid, or patient develop vasoconstriction. This is a complication. So all what I talk, it is important to maintain the proper normal range of electrolyte, right? Like sodium, the normal range is 135 to 145 milliequivalent per liter, right? 135 to 145, we must know. So if you ask me, what are the normal function of sodium? The normal function of sodium to maintain the fluid balance in the body, to maintain the normal nerve function, normal muscle function. So sodium, when normal, I mean in between 135 to 145, your nervous system work well, your muscle system work well, right? So if anything happening, like fluid loss I said, or GIT loss, diuretics, kidney does not function well, or hyperglycemia or heart fail, the sodium level go down less than 135, and this is called hyponatremia. When the sodium level is going up more than 145, which is called hyponatremia. So if we go here, we said hyponatremia, hypernatremia. So as I told you, when patient develop hyponatremia, means less than 135 milliequivalent per liter sodium, and cause of the loss of sodium may be GI loss or gastrointestinal fluid loss, or kidney disease, or even sweating. Too much sweating is called skin loss, or hyperglycemia, complication of diabetic, or heart failure, right? So all of them lead to the hyponatremia. And symptom, when patient develop hyponatremia, what are the sign and symptom, right? Patient is lethargic, confused, anxiety, muscle twitching, also abdominal pain, and this is called abdominal cramping, nausea, vomiting, finally lead to the involuntary movement of muscle and is called seizure. So as a RN, what is your intervention? Is called nursing intervention. Definitely, if your patient have hyponatremia, we has to give them or admin isotonic solution. There are three types of saline solution: isotonic, hypertonic, hypotonic. But if your patient has a hyponatremia, you give them isotonic, means 0.9% sodium chloride. Also increase the sodium intake, right? For acute hyponatremia, admin the hypertonic IV fluid slowly. So here is the nursing intervention. When you read, you can get same information what I'm explaining. In case of hypernatremia, same, what are the cause? Means water deprivation, excess sodium intake, kidney failure, or patient develop the Cushing syndrome. If patient has a Cushing syndrome, or diabetes insipidus, or excess sweating, can possible to develop hypernatremia. Increase the sodium level more than 145 ml per equivalent, right? And what are the symptoms of hypernatremia? Patient develop tachycardia, muscle twitching like hyponatremia, muscle twitching or weakness, GIT upset, right? And also patient develop the postural hypotension. Postural hypotension means blood pressure change because of changing the posture. In case of severe hypernatremia, patient level of consciousness decrease, shortly called LOC, or patient will be confused or disorientation. They do not tell what they have confusion about the place, time, right? So also develop the convulsion. So if your patient has a hypernatremia, how we have to take care of them? We should admit the isotonic solution again, like the hyponatremia, and also we give them IV fluid or decrease the sodium intake. Hypernatremia, increase the sodium. So we have to tell not to take the food contain high amount of sodium. Also increase the water intake. So if you read here, you can get same thing. Monitor input output, monitor the mental status because they can lead to confusion or disorientation. We encouraging them to take the fluid. Also restrict intake of salt or high sodium content diet. Now go the next one. This is called potassium, right? Potassium is the shortly called K. The normal range of potassium 3.5 to 5.0 milliequivalent per liter. 3.5 to 5.0. So potassium, if it is imbalanced, either hypokalemia or hyperkalemia, both can lead to heart problem and develop arrhythmia. It's called dysarrhythmia. And patient finally die because of arrhythmia, right? So potassium is like the sodium. What are their normal function in the body? So normal function of potassium, they maintain the intracellular fluid. Also, they are important component of nerve function, means nervous tissue. They regulate the muscle and heart contraction, right? So in case of if the potassium level less than 3.5 is called hypokalemia. If potassium level is more than 5, okay, it is called hyperkalemia. It is super important for NCLEX board. We must know. So hypokalemia, what are the major cause of hypokalemia? Like as sodium, GIT loss, gastrointestinal fluid loss like vomiting, diarrhea, or diuretics, too much pee, urine output, or sweating, skin loss, metabolic alkalosis. Metabolic alkalosis develop the hypokalemia, vomiting, gastric suction, diarrhea, right? Use of potassium wasting drugs like diuretics or poor intake of potassium, all of them lead to develop hypokalemia. What are the signs and symptoms of hypokalemia? I told the major problem is the cardiac dysarrhythmia. So dysarrhythmia lead to supraventricular tachycardia or ventricular tachycardia or ventilation fibrillation. So basically all of them lead to cardiac dysarrhythmia and patient finally die because of dysarrhythmia. And also, what are the other signs? Muscle weakness, like a sodium, or cramping of the muscle. Patient develop constipation, like calcium. Also, hypotension or weak pulses. So this is the sign of hypokalemia, right? So metabolic alkalosis develop. This is the question NCLEX board asks. Now go for nursing intervention. It is here. You have to read when you have time. So as a shortly, I am explaining if your patient has a hypokalemia, we has to increase the food rich in potassium because patient is hypokalemia. You have to give them the food what are the rich in potassium and also administer supplement by IV or we have to monitor the cardiac function, right? So here I'm reading, monitor the client receiving the digoxin very closely. If patient has to take the digoxin because hypokalemia increases the risk of digoxin toxicity. Digoxin is the important medication for heart failure, but digoxin toxicity is very high. If you prescribe the digoxin to the patient, we have to monitor the patient for digoxin toxicity. Now go hyperkalemia. So hyperkalemia means increase the level of potassium. What are the cause? One of the cause is a very important cause of uncontrolled diabetic mellitus is called DKA, diabetic ketoacidosis, or metabolic acidosis. Here is the metabolic alkalosis. Here is metabolic acidosis. If patient has a metabolic acidosis or salt substitute or kidney failure or potassium sparing diuretics like spironolactone, they has a chance of develop hyperkalemia, right? So excess use of salt substitute, renal failure, potassium sparing like spironolactone, they develop hypokalemia. So what are the signs? As like a hypokalemia, hyperkalemia also develop dysarrhythmia. It's called cardiac dysrhythmia or cardiac arrest. Same as hypokalemia, they develop muscle weakness or numbness or tingling sensation. Okay, and also they develop the diarrhea. So if your patient has a hyperkalemia, how you have to take care of them? Closely monitor for cardiac arrest. Like we have to check for EKG, electrocardiogram, we have to check. What are the other intervention? We have to limit the food high in potassium. Also, we give them insulin with a dextrosaline solution. Now go, the next one is called the calcium. Calcium and magnesium and phosphorus is very important component for the bones mineralization or equal distribution. Calcium normal range is 9 to 10.5. Some books said it is 8.5 to 10.5. Okay, calcium. So the normal function of calcium or magnesium, they are important component of bones and teeth formation. They are important for the nerves and muscle function like potassium and sodium. Also, calcium is important for clot formation in the blood. Clot. So, the calcium level when go less than 9 or 8.5 is called hypocalcemia. When calcium level go up more than 10.5 is called hypercalcemia. So hypo or hypercalcemia, if we go here, what we can say, hypocalcemia here. Hypocalcemia, basically the cause of hypocalcemia, major or only one most important cause is vitamin D deficiency or inadequate vitamin D intake. Inadequate vitamin D intake can cause hypocalcemia or hypoparathyroidism. Like the surgeon is doing the thyroid operation, thyroid, suddenly or unfortunately remove the parathyroid gland. If the parathyroid gland is removed, they develop the hypoparathyroidism. Hypoparathyroidism, when occur, the parathormone go down, and parathormone produce the calcium, and calcium also go down, and patient develop hypocalcemia. So surgically remove a parathyroid gland or hypoparathyroidism or hyperphosphatemia or pancreatitis, acute pancreatitis, hypoparathyroidism, hyperphosphatemia, alcohol abuse, also hypocalcemia. If your patient has a hypocalcemia, right, what are the symptoms? Super important. If your patient has a hypocalcemia, they have a chance of develop potassium positive Chobbick sign or Trozier sign is positive. So what is this? So when patient has a hypocalcemia, right, patient has a chance of develop tetany, okay? It just means involuntary muscle contraction. Especially the muscle is skeletal muscle is under our control. So you movement your hand, but if your hand is not your control, it will be make a big problem. Suddenly you are walking beside of someone and your hand not your control and touch something, right? Very weird situation. Tetany develop, then chop big sign positive. If you sticking in the cheek muscle, it should be moving towards the zygomatic bones. Or trouser sign it should be positive. The other sign symptom of low calcium, muscle cramping, abdominal pain, periodical tingling sensation, and finally seizure. So NCLEX board asks, when low calcium or hypokalemia, which sign should be positive? We can answer patient develop tetany, or positive chop big sign, or positive trouser sign, muscle spasm, abnormal sensation or numbness or tingling, and also GI upset, hypotension, decrease the heart rate. So when your patient has a hypokalemia, how we have to take care of them? Here, right? Increase the food high in calcium, or provide the supplement. So initial safety precursor to protect the confused client, to protect the confused client here. And also admin oral or parental calcium supplement. Hyperkalemia, when the calcium level is more than the normal, right? And this is called the hypercalcemia. So hypercalcemia cause is hyperparathyroidism, or long-term steroid use, or bone cancer. So if your patient has a bone cancer, malignancy of the bones, hyperparathyroidism, or prolonged immobilization, the chance of hypercalcemia develop. So you know that calcium, magnesium is important for your bones and teeth for good mineralization, but too much good is not good. When it is too much, your bones will broken down. So the increase the risk of fracture of the bones when it is too much. So the sign and symptom of hypercalcemia, they develop constipation, they develop decrease the deep tendon reflexes, and they develop the kidney stone formation or lethargy. So constipation. And I said deep tendon reflex decrease. This is the question NCLEX board asks. In case of hypercalcemia, what are the signs? Decrease deep tendon reflex. Pathological fracture is more common. Means increase the risk of fracture. So how you have to take care of your patient if the hypercalcemia develop? Increase the client movement and exercise, because immobilization is a cause of hypercalcemia. Also protect a confused client. Monitor for pathological fracture in the client with a long-term hypocalcemia. Also encouraging intake of acid ash fluid, right? Like cranberry juice. So this is the intervention we have to take for the patient in case of hyperkalemia. So now go magnesium. So magnesium, another important component in the electrolyte for the acid-base balance. So magnesium, the normal range is magnesium 1.3 to 2.1 milliequivalent per liter. So if the magnesium is, okay, first of all, what are the normal function of magnesium? They are important component for nerve and muscle function, bones formations, or critical for many biochemical reaction in the body. So magnesium is important for some biochemical reaction, what is called metabolism. Okay. So metabolism is a chemical reaction basically, and food particles grow, break down, and produce energy. So magnesium is the important component of chemical reaction, right? So if the patient magnesium is less than 1.3 milliequivalent per liter, it is called hypomagnesemia. If the magnesium is more than 2.1 milliequivalent per liter, is called hypermagnesemia. So hypomagnesemia, the cause is GI or gastrointestinal loss, diuretics, malnutrition, or alcohol abuse. This is the cause of hypomagnesemia. Long-term use of certain medication like diuretics, aminoglycoside antibiotics, right? Sign and symptom of hypomagnesemia. Thanks God, the sign and symptom is almost same of hypocalcemia. Like if your patient has a hypomagnesemia, they have a chance of develop tetany, they had a positive chopstick sign and positive trouser sign or trouser signs, right? And also they have developed the neurovascular irritabilities and tremor, convulsion, cardiac dysrhythmia, hyperactive deep tendon reflex, right? And finally develop psychosis or seizure. Like as the they have also developed the constipation or ileitis. If your patient has a hypomagnesemia, you have to take care of them, right? We has increased the fluid high in magnesium, or we has to provide supplement like oral magnesium or calcium, we has to protect the patient from injury or seizure precursor. So NCLEX board asks frequently, it is not mandatory here, but I don't want to miss this chance to explain. It is here because frequently asking question, frequently about the seizure, right? So first of all, I said the seizure is the uncontrolled electrical discharge of the nerve from the brain, involuntary movement of the muscle. Seizure is occur because of epilepsy. It's called chronic seizure. So as a RN, it is our responsibility. If patient has any kind of seizure develop, we have to make the precursor for management of seizure. So what is our nursing care for the patient? right? So nursing care during the seizure, always turn the patient to the side, okay? And also loosen the tighten clothing and do not insert anything to the mouth. Do not insert airway or restrain the patient. And we have to keep the documentation on documentation on set or during the seizure. So, and when seizure subside, we have to check the vital sign. We have to neurological check or also reorient the patient. Seizure precursor or determine possible trigger. It is really important. How to measurement, how to precursor the seizure. So go back in the our main topic, hypermagnesiumia. When the magnesium level more than the normal, I mean magnesium is more than normal, which is called hypermagnesiumia. So again, I said the cause of hypermagnesiumia may be the DKA, means diabetic ketoacidosis, or dehydration, or Addison disease. So kidney disease, some laxatives also contain magnesium and causes hypermagnesiumia. Hypothyroidism causes hypermagnesiumia. The symptom of hypermagnesiumia, they cause hypotension, they cause muscle weakness, lethargy, respiratory and cardiac arrest if not treated. So neuromuscular depression, cardiac muscle depression, they develop arrhythmia or asystole and patient die. So the intervention or how we have to take care of them, initiate the safety precursor, monitor the blood pressure or monitor the pulse and respiratory closely, and admin the calcium gluconate. So hypermagnesiumia, what are the medication? Calcium gluconate. This is the question asked. Super important, every information from here. And also we teach the patient with renal disorder to avoid the parathyroid containing medication. So okay, so now phosphorus, right? The normal range of the phosphorus 3 to 4.5 milligram per dl. So phosphorus is also related to the hypoparathyroidism. So if the patient develop the hypoparathyroidism, the phosphorus level go up. So I want to recap it. Phosphorus. So if patient develop hypoparathyroidism, so hypoparathyroidism means parath hormone go down, calcium level go down, but phosphorus level go up. On the other hand, if patient has a hyperparathyroidism, that case patient has developed the parath hormone go up, calcium level go up, but phosphorus level go down. Okay, so this is the normal range of phosphorus 3.3 to 4.5. If phosphorus is go up, is called hyperphosphatemia. The cause of hyperphosphatemia is hypoparathyroidism. if the potassium level, phosphorus level is more than 4.5, is called hyperphosphatemia, causes hypoparathyroidism. If the phosphorus level is less than 3, this is called hypophosphatemia. The cause of hypophosphatemia is the hyperparathyroidism. When hyperparathyroidism develops, patient's parath hormone go up, calcium level go up, but phosphorus level go down. This is the opposite. The relationship of calcium or phosphorus is opposite. When calcium level go up, phosphorus level go down. When calcium level go down, phosphorus level go up, right? So this is the very basic information about the electrolyte, what we have to know for NCLEX board.